quite some time, and he is an expert on all things health. So I wanted to get Mike on to kind of give folks an update about what's going on in Panama health-wise, COVID-wise, travel-wise. I met Mike kind of late in the game, as I'm finding out prior to us talking, or at least us starting this broadcast. Well, first of all, Mike, thank you for hopping on here, man.
Yeah, I can. Thanks for having me, man.
Yeah, no, absolutely. So Mike has actually had a whole operation since what you said, 2013. Is that right?
Yeah, we started in 2013. We opened up a medical center in Panama Pacifico. And yeah, we've just been, our focus has always been kind of primary healthcare for the residents and the businesses that are located in that area. We've done a lot of occupational healthcare, so we help all the companies here. There are a lot of multinational companies, so we help them with all of their occupational, their annual exams, their pre-employment exams, and we have English-speaking medical professionals and doctors and physicians and specialists. So we've always been able to, take care of all of their needs. And we started there and then kind of, expanded as more people moved out here to live. And so we, just kind of developed that part, primary care. We have our physicians full time. We have a pharmacy, and we have medical specialists, but pretty much any specialist that you need, we set that up for you out here at the medical center. And now we're doing a lot more at home. So like house calls, we send our physicians to you. We send our lab techs to you, whether it's lab work, COVID testing, whatever it might be.
English speaking physicians, if I might add. Yeah.
Yeah, our physicians speak perfect English. So, for a lot, especially within the expat community, where you're, when it comes to healthcare, I mean, they have to speak your language. It's hard when there are communication issues. So, and a lot of people have already know, our medical professionals and our physicians, and they're great. And yeah, it's a big thing, I mean, the communication is key. So we really kind of strive to make sure that that's like, that our physicians are speaking English, and, that's an important part.
Absolutely. Yeah, no. And one of the reasons I want to get you on here today, and thanks again for making the time, is, you and I first got to know each other as you launched another component of your business, which is the pre-travel COVID testing, which now it's like, if you even mentioned that in Panama, Mike Kelly, call him, call his company, get taken care of immediately, fair prices, etc. This isn't an advertisement, but it's important that people know what you do. So yeah, I mean, let's get into the situation a little bit for folks that are not in Panama, kind of what's going on. Of course, I can say that everybody's still wearing the masks. We still sort of, I haven't run into too many places where they're actually like asking for your tarjeta de vacunación. A couple random restaurants, but what's been your experience on the street, Mike?
Yeah, it's, as everyone knows, we had if you don't know, we had a pretty severe lockdown here, where, we were locked in and you could only leave on certain days. Luckily that opened up, there've been heavy mask requirements, and a lot of people took that to the extent of wearing their mask outside, doing exercise and things like that. People relaxed a little bit, as far as, being outside, and taking off their masks. But, generally here, if you go into any kind of commercial establishment, you're gonna have to have your mask on, which is fine. And, it's, with the vaccination, you mentioned the, showing your vaccination card going into, commercial establishments. I've seen it a few times. It hasn't been something that's really been enforced. I've gone to a couple places where, they'll ask for it, and if you don't have it, they'll tell you to bring it next time. But they have really like pushed it on you where you can't go in, at least not that I've seen yet. We'll see what happens moving forward. But, right now in Panama, we've got the Omicron strain making the rounds. So cases have, skyrocketed really, within the last couple of weeks, and that's what kind of everyone thought was going to happen with this strain. The thing is that it's so transmissible. You get sick within 2 to 3 days of being exposed, right? However, the symptoms are less. The symptoms are more mild. So if you get it, you're not going to get as sick as you would have with the Delta strain or the original.
Yeah. So, and sorry to interrupt you a little bit, but to kind of go into, both Mike and I are Americans. Both Mike and I travel to the States a lot. I know you were just in California over the holidays. Is that right?
Yeah. Yeah. I was there for Christmas.
And I go to Texas. So the thing is, I would say on a spectrum, I think those two states are kind of far apart from each other in terms of, like COVID restrictions, requirements, sort of the stigma or the perception of things like if you're not wearing a mask, so you are, that kind of thing. Where would you say Panama falls into that as far as, whether it be government policies or just people on the street, people at parties, people in restaurants? Like, are you getting a bad look if you kind of would rather just take your mask off while you're exercising, or what do you think?
Here in Panama, you have to keep in mind that, when there are things like this, people generally, fall pretty in line with the government mandates, government requirements.
We follow the rules in Panama.
With all the rules, generally people are just going to fall right in line with that. There was a lot more fear in Panama of COVID than there was in the United States, for example, where, a lot of, I talked to a lot of people back in California, and they're pretty much saying, telling me that it was like COVID didn't exist. The people were living their life, no masks, going in, they were just kind of tired of the whole thing.
Now, this is right now in December, right? When you're
right. Well, this was like up to December before I went. And so I was hearing a lot of that. Now it's spreading in California and the United States, just like it's spreading here, no different.
Sure. Yep.
But generally here, the stigma, is, definitely if you're not wearing your mask, you're going to get some weird looks, whether or not you're vaccinated, whether or not you've had COVID, I think it's a good idea when when you go inside a commercial establishment, put on your mask. If you're not personally worried about getting it, then, do it so other people are more, kind of ease, it's one of those things where, people are worried about it, people,
right.
So if you can kind of ease their mind, a little bit, put on your mask when you're inside getting shopping. When you go outside, take your mask off. That's fine.
Actually, I mean, that's almost a whole nother topic that you and I could talk about as expats, but it's like, hey, we're still visitors, right? Like,
right.
Might as well try to not assert your freedom and independence, whatever. I don't want this to get into too political, more just give people an idea about what's going on in the street in Panama. But yeah.
That's right. It is what it is. The situation is what it is. And, it's, we got to be careful still. I mean, even though Omicron is less severe, we all have to be careful and mindful of that, so yeah, I mean, that's a general, that's the situation here, so we're, still wearing masks when we go inside an establishment. But I do see that people have relaxed, I do see more people outside not wearing.
I think
you have a lot of people that have already had COVID. You have a lot of people that have had the vaccine, so that brings that ease, the ease of mind. So people are going out and just generally more relaxed, less, I mean, like less fearful, I mean, I think things are definitely getting better.
Yeah, no, for sure. Well, before we wrap up, would you mind sharing, because it's a moving target, and unless I hit refresh on the government's page, and what's current travel restrictions into and out of Panama, and maybe going back to the States or coming in from the States, for example? Can you give us sort of the rundown on what's going on today on that?
Sure. Yeah, coming into Panama, you don't have to be vaccinated. However, if you're not, you have to arrive with a negative COVID test, and if you're coming from a high-risk country, you have to self-quarantine for 72 hours. Otherwise, it's just a negative COVID test. Leaving Panama, let's say if you're going to the United States, which, a lot of people are traveling to the U.S., you need a negative antigen test. So it's an antigen test to go to the U.S., it's an antigen test to arrive in Panama. And so those, in the U.S., they still have not waived any of the testing requirements to go there. No matter what, to go to the United States, you have to present a negative COVID test when you check in.
It froze. I hope it's not on my end. Mike Kelly, you still there, brother? Shoot. Well, guys, I don't know if you can see me. Hope it's not my internet. Maybe Mike will be back, and I'll just keep talking for another minute and allow for him to reconnect again. Hopefully it's not on my end. How about that? Interesting, right? That's what's going on in Panama regarding COVID, the health situation. Call Mike. Look up his company. We'll put the URL on the comments about how to get in touch with him. At home health services, COVID tests, same day, same results, quick results, I should say. Mike's awesome and very good at what he does. And Mike, if you pop back on, thanks for joining. So we'll wrap this up, guys. Sorry for the tech difficulties, but hey, it's Panama. Sometimes it gets a little hiccupy. Have a great day.